Good morning and welcome to all of you at ABC Medical Center. My name is Hannah Locke. For those of you who may not know me, I am the CEO. I've invited you here today to discuss a brand new, very expensive and highly comprehensive electronic health record system that we recently purchased for our company. We will soon enter this new EHR into our systems and database to be able to better connect us with our patients and all of their information to be stored. A lot of changes are going to be happening from this point forward, but we will implement this new EHR system with great pride and expectations. A little bit about the functions of our new electronic health record system. It's very complex. It holds a massive amount of detailed information on each and every patient that we encounter, diagnosis, and treat, so we can have all that information for other times if need be. It has the capability to store patient demographics, patient history, current and old medications, current and previous problems that they may have, lab results of any kind, whether they do that here in our office or if it's something that they bring in from outside, procedures and surgeries that they've had done, clinical documents, all of that information, messages between the patient and the provider if that happens outside of the office, all that's in there. Our orders, care plans, education tools, reminders and alerts when they're due for exams and things like that, assessment and plan options, insurance information, claims, along with any pharmacy information for e-prescriptions that we may need to send over for them. Basically, essentially, anything and everything you want to know on a patient under our care will be stored under that electronic health record system. Some advantages to our electronic health record system are if our patient is out of town, they can easily access the information that's stored. Say they are in California, they live in Florida, and they have some type of allergic reaction. They go to the nearest emergency room. They can easily look up anything in their electronic health record in Florida that will have that information that the doctor treating them in California can help them with. Tracking the data encourages patients to be more involved in their healthcare. They can see that progress. It can be a motivator for them. mHealth, known as mobile health, is also a great access to our healthcare system. It makes health records available from any mobile application on our patient's phone, very easily accessible. Multitude of applications for all phones and patients. They can download it, install it, just bettering their health. Some applications involve like weight loss, calorie tracking, exercising, meal plans, how to cut back on smoking, medication reminders, etc. You name it, I'm sure there's an application for it. We definitely need to encourage our patients to use these applications to help better their quality of health. Our electronic health record system will also send patients reminders when they're due for their exams, like as we discussed earlier. It'll let them know, hey, you're due for your annual exam at your primary care physician, things like that. It will also send out alerts for possible drug interactions. Say one doctor sent a prescription for a certain medication and they go see another doctor and that doctor wants to send a different medication. If there's a drug interaction, the electronic health record system will say, hey, no, we can't do that. There's going to be a drug interaction. It also puts the patient in the spotlight for their healthcare by letting them be heavily involved in their own healthcare. Instead of the doctor just making all the decisions for them, they can educate the patient to let them know, hey, this is what's going on. How do you feel? What do you want to do, with their medical advice? Another good advantage is that multiple providers can access patient records. As we talked about earlier, the patient in California, in Florida, that doctor can access their records if need be, if the patient is unaware, unfamiliar with what previous medication that they were on or something like that. The new electronic health record system also is to be more engaging with our patients. They need to be involved in their healthcare, definitely. It helps them feel like they are in control or empowering, so they have a say-so in those decisions that are, with their healthcare. Collaboration between, all the doctors, you being the staff, the patient is the way of the future that we must get on board with. We will have purchased this with opportunity for the patient and provider to communicate, make decisions on their own healthcare by, participating in and being informed about it. As healthcare professionals, we must be open and transparent as possible. Ultimately, this will assist with getting our patients off of Google. We definitely don't want them, Googling everything that we tell them. We would rather them, go and onto our websites that we may have that will give them the appropriate information, the accurate information. However, do not get confused. This doesn't fully mean responsibility will be left up to the patient as they are taking part in their own healthcare. We still need the medical advice from the healthcare professionals. A new nifty thing that our electronic health record system allows our patients to do is get on the portal and update their information, making sure that it's accurate as well. It creates a personal health record, allows the patient to enter all of their information into the system to ensure that it's correct, prevents any wrong possible information that may be accidentally entered by the staff that could get in there. This includes their demographics, medications, surgeries, immunizations, lab results, current health problems, previous health issues, anything we need, that pertinent information to be able to establish a record for that patient. As well as we are going to be using many various social media tools to help with our new electronic health record system. Advertising, we can advertise in magazines, billboards, posters, things like that. But that is a way of old-fashioned kind of sort of now with the new technology that we have. With the social media, we have Facebook, we have Instagram, we have Twitter. Most of our patients are always on their phones. They're always on some type of mobile application like that. So it would be a great way to reach out in ways of effective communication to be able to get them to join in on things. Training allows for immediate answers to questions that may be asked during a session. During those training exercises, we need to join efforts with others to keep them from losing the focus of the staff with, boring lectures. Being interactive, using social media platforms as a way to communicate and collaborate will keep the learning interactive and engaging. Sharing information. Patients heavily rely on social media as a source of information when it comes to learning about a new diagnosis or finding out things that are new to them. They like to join Facebook groups and try to say, hey, this happened to me, what happened to you? That can sometimes be dangerous, but can also sometimes be helpful. They're able to share opinions, thoughts, ratings, anything else they can think of to help others and themselves when it comes to making the right choices on their healthcare. Investigating online can be very beneficial when we are providing that correct information for them, definitely. We can also share tools that will be valuable information, like we talked earlier about the websites to get that information to come across to our patients or future patients. They are, counting on us to have that interaction and correct information with them through our websites. But we do need to be careful when we are doing all that information on the internet. As far as the HIPAA laws and rules and regulations. It's important that we don't violate any of that with our patients' privacy while we are doing that as well. I'm sure that we all here know the rules of HIPAA, but now with more access to the internet, social media, mobile devices, please be very exceptionally vigilant when it comes to sharing that information. Updating our patients with accurate information is an enormous way to advocate our hospital as well. We must establish a routine with regularly making sure our information is up to date. We definitely don't want our information on our websites or our hospital posters hanging in the hallway to be wrong or outdated information. It's important that we have the newest healthcare recommendations and things like that out there that's properly displayed. Interactions with our patients. I know there can sometimes be a downfall in the area of interacting with patients more when it comes to using an electronic health record system. Patients may complain that the healthcare professional in front of them are spending too much time looking down at their laptop or their computer, which is, a problem. So we need to make sure that we are actively looking at our patients in the eye, talking to them, not facing the wall. We need to let them know that we are, in fact, listening. Before you enter the exam room, look at the patient's chart, educate yourselves with all of their information that they have in there so you can sound educated when you go in there with the patient. It's there for a reason for you to look at. You don't want to be spending too much time staring down at the computer like this, while the patient's in the background talking to you, because then it makes the patient feel like they're not being listened to. Showing the patient the screen whenever possible. If there's like a graph or, information on the screen, lab results, charts, anything like that that the patient can physically look at with you will definitely be a great thing for them to, again, make sure that they are actively being involved in their healthcare. Always face the patient. Do not turn your back and face the wall. That gives them a signal to the patient that you are not really listening to them. Face the patient as much as you physically can and look up from the screen whenever possible. Reply to the patient. Let them know that you're listening. Portal messaging. Some patients may have questions after they leave the office. So in that case, our electronic health record system has a portal that frees up the schedule for more patients to be able to get on. And it clears the phone lines for less needed callbacks because the patient can use that portal system to be able to communicate with the physician outside of office hours. And things like that. But of course, definitely if there's some type of serious issue, we need to make sure that we are bringing that patient in to see the doctor. In conclusion, as I said before, this will be a massive undertaking to implement and be successful in our efforts to, implement this new EHR system. It will take a large amount of time, diligence, perseverance, and dedication to get this EHR system up and running and functioning in an appropriate amount of time. But once done, it will not only benefit us as a team, but our patients as well, the organization as a whole, and altogether streamline efficiency, productivity, and profitability towards ABC Medical Center. I do appreciate you for listening and having a great time at this meeting, and I hope you all have a wonderful day. Thank you so much, staff of ABC Medical Center.